Hi, we are Federica Avesini, Odira Ezeifredi, and Michaelis Angelus Georgiu.
So, starting with the problem that we're facing, depression is a very usually underdiagnosed and misdiagnosed condition with no reliable or very little reliable testing in the form of clinical questionnaires that are hard to organize for physicians, for them to have as clear and specific cutoffs for physicians, and also to have a more warm approach towards the patient. This, especially when it has to do with combining all these approaches together into a single unified model that can do all of the aforementioned things. So, administer these tests with the correct language and reaffirming language, produce all the necessary cutoffs for patients, for doctors, and have a way after to elaborate these results for the doctors and so they can administer better care to the patients. So what we have proposed is a model that does exactly all that. Um, we can access a variety of license-free um, um, the questionnaires about depression, administer them to the patients using simple but warm language, then produce cutoffs in various quartiles to um, signal any alarm bells that might be possible to be seen. Give that information directly into the doctor, and optimize all these different modules into a simple single unified system that can do all that with ease and with ease of use and ease of connectability.
In the opening of our app, the user can easily see what is going to receive. First of all, the purpose and whatever is provided or not provided by it. And first of all, we give a strong importance to safety. Let's get more in depth into how it's built. So the patient is administered different questionnaires that are standard questionnaire for the diagnosis of depression that are used in every day for by psychiatrists for the diagnosis. Depending on the result, there are different possibilities. So, a patient is not depressed or have mild depression, but in more severe cases, like patients who are severely depressed or show suicidal intent, there is the chance, as we can see in a few moments, to have the access to suicidal hotlines or prevent suicidal hotline or that allow the patient that is in a specific need and in a precarious state in a specific moment to receive the best help as possible. Also, the information are sent to the provider, and this is really important because it helps to track the wellness of the patient, and in case also is important because it can allow to start a specific intervention, and also in case of a high suicidal risk score is sent an high alert to the provider itself.
Okay, so like my colleagues previously mentioned, we hope to show that AI could be a crucial tool to help physicians and specifically psychiatrists in monitoring and diagnosing patients affected by depression, specifically major depressive disorder, and also help physicians assist these patients from a remote kind of way. So in this case, we could also implement other types of features that could be useful both for the patients and for the physicians. For example, the patients could benefit from it thanks to the application always working and always being available for them, and the physicians could be also aided by it because they could receive promptly different types of messages or alarm and delivering of emergency that their own patients are facing in a specific time. So uh, we think that in this project we could have feasibility and implementations, and we could find customers both on the patients and the physician side. Maybe we could, for example, give some aid to the patients, and we could provide some, for example, cheaper visits to the psychiatrist due to the fact that the psychiatrist would be able to collect much more information and data about their own patient. And on the other hand, to physicians, because they could be able to follow much more patients at once, and they could be able also to understand whom to focus their attention on. So we're going to have risk stratification, quartile divisions, and more detailed statistics from something like this. And the patient would not feel that he's just simply filling scores, but he would have a personalized approach.